Reiki students and friends. I'm Lourdes Gray and this is Sasha. Sasha is a canine Reiki practitioner and my model for whenever I demonstrate how to do Reiki for pets. And Sasha and I want to show you a few ways by which you can treat your pets when they're reluctant to receive Reiki. So let's go ahead and get started. All right. Now, I have some suggestions for you as to how you can get your pet accustomed to receiving Reiki. If they're having a little bit of a difficult time, it's not that they don't like Reiki, it's that they're unfamiliar with the feel of energy flow. And it's a good idea to start working from a distance. So don't just start the Reiki session hands-on, work from the aura, work from a distance. Get far away, far enough so that they're relaxed, and you can tell they're relaxed because they are lying down comfortably. They're not panting. Notice, she's a monkey. Notice how she's just very, very relaxed. Down all the way. Good girl. Down all the way. And deliver Reiki right from the aura. And you can go through all of the positions, all of the Reiki positions like this, right from the aura. If she starts hesitating or acting uncomfortably, I'm just going to go a little bit higher and work from a further distance. She's still receiving the energy, but not as directly, and this will help her relax. Also notice if there's a change in the breathing. If your pet starts taking deeper breaths, okay, and they become more and more relaxed, they start closing their eyes, that's a good sign that they're relaxed, they're enjoying the Reiki treatment. See that? She just had a change in her breath. And just work from far away. You're still being effective, and the energy is getting to where it needs to go. Okay, now say that your pet has had a surgery, for instance. Maybe surgery on the hind leg, right over here. How do we treat? Well, if you work hands-on, it's very likely that the feel of the warmth from the Reiki will be a little too strong for your dog. Not that it will hurt your dog in any way, but it may cause your dog to shy away. So if I were treating a dog that had an incision on the hind leg, what I would do is work from about this far away and notice how my pet reacted. And as I hold my hands from this distance, I'll start having a sense of energy flow. I'll feel a connection, like a stream of energy going into the dog's leg. And if I have to, move a little further out. That's always a good idea. Just go a little bit further out. Okay? If I see her panting, I would definitely go a little further out or discontinue the session. Give her a little break. That's a sign that she's getting a little bit anxious because of the feeling of the warmth or the current of energy flowing into her body. Remember that pets, animals, are much more aware of energy than we are, much more sensitive. So you have to take that into account. Lie down. Good girl. Lie down. Oh boy. Now, another way that you can treat a reluctant pet is use one hand for petting and the other hand for the delivery of Reiki. And this works very well because your pet will be focused on the feel of the hand doing the petting, and you can kind of disguise the feel of the energy flow coming from the other hand. So this works very, very, very well. Okay? Remember that if you work on one side of the body, and usually your pet will be lying down on its side, just like Sasha, after a while, do the other side. If they need to get up and move around, take a break. It's okay to take a break, and then continue the Reiki session after your pet is ready to receive again. And continue from where you left off. So if I if my last position was here, and Sasha and I took a break, then I would continue from that point on. Just continue from that point on. Go to the next position from there. Okay? Do the spine. That's a very good place to treat. And what you can do, and I'm going to go right here over Sasha and show you, is make long pads with an overlap for the spine. And this is very comforting and relaxing for your pet. All right. So let's recap again. Okay, if your pet is hesitant to receive energy, and it could be that they just had surgery, they've been fine with Reiki, you've been giving them Reiki for quite a while, it's never been a problem, you've been able to work hands-on, but now they had surgery, and they're guarding that surgical site, they're guarding the incision, they're very aware of any feeling, of anything that's going on around the incision. Work from a distance. Move away as far as you can, okay? And treat from there. If Sasha started acting anxious, panting for instance, as I worked on this area, I would move further out. Go as far out as you need to so that your pet is nicely relaxed. You can treat from there, and then gradually, over a period of session, start coming in closer and closer. And you can be just as effective treating from the aura as you would hands-on. In fact, sometimes it's better to treat from the aura. So don't hesitate to treat from the aura. Now, if you're treating your pet after surgery, make sure that you're treating on a daily basis. Even if you have to break that session into 5, 10, 15-minute increments, do that. And if you can arrange it so that you can do a full hour a day, but it doesn't have to be all in one session. Break it into little chunks of time. That will help your pet feel much better and heal a lot faster. Thank you for watching.